Hi, everybody. This is Becky, LuckyVitamin's junior category herbs. For today's Omega by Jolie Root. Jolie Root, educator, senior nutritionist in laboratory. North America, attending, educating, and integrating. Turn things over. Just webinar is being recorded. Conclusion. This webinar, please screen as many as possible.
Everybody, and welcome. I'm really happy to be kicking off my new year with another webinar for LuckyVitamin. And I want to wish everybody a very happy and healthy 2018 since it is so early in the year. I'm excited about this topic because it shows how we empower ourselves with nutrition. And so in breast health, this is an issue that concerns everyone, not just women, men can have breast health challenges as well as women. And of course, so many of the women who deal with different breast diseases are loved by men and are in families with fathers and brothers and husbands. And so this is a topic that concerns everyone. And another thing that I think is interesting about breast health awareness is that many of the things that we do that benefit the health of breasts in men and women also help our hearts and help our brains. So with that, I want to move on and see if that's here. I like to start at the foundation whenever discussing any kind of health. And I think that an overarching thing that most of us could improve upon is the array of colorful foods that we eat in the course of a day. And so Eat a Rainbow is a message that I think is really important to share, that we eat as many different colored fruits and vegetables and even grains as we can in the course of the week. And some days are going to be better than others. So if we have a low day, then we just want to come back and maybe try a little harder the next day. But when we're shopping, look for colors. Look for brightly colored fruits and vegetables, things that are strong in antioxidant power and nutrient strength. So we're really looking for a nutrient-dense diet rather than a nutrient-void diet, which is what happens sometimes with convenience foods and with a lot of the Western diet ingredients. So eating a rainbow is a place where we want to start. And then we need to move on to this topic, which is omega-3s, because it's so important to focus on your intake of omega-3s. And starting with fibrocystic breast disease, which is something that a lot of women struggle with, and a lot of women have breast pain, even in some of their youngest years. And so sometimes that's a cycle and time each, but not always present. No seeming cycle. The omega-3 DHA, shown studies and to reduce and lower fibrous breast. One of the hated of the EPA and DHA pain. Who has written particularly an foods or supplements rich in omega-3s, and the foods that are rich in the omega-3s that are known to be most active for dealing with breast pain are marine sources, so fish and shellfish. But the plant omega-3s help too. So flaxseed and other garden omega-3s, not water or marine derived omega-3s, also can be helpful just for one thing, because if you're focusing more on both marine and plant omega-3s, it leaves less room for the more problematic omega-6s, which are pro-inflammatory and associated with some health issues that when they're out of balance, when the omega-6s are too high, with health issues like breast diseases and also heart disease and other issues. So foods and supplements rich in omega-3s, along with higher fiber, and getting our fiber from plant-based foods, from the fruit and vegetable family, along with whole grains, is something to think about. Now, as far as breast cancer goes, here in the Western culture, breast cancer represents about a fourth of new cancer diagnoses in women. 1 in 8 women can expect to be diagnosed with breast cancer during her lifetime. And we have advances in screening and prevention, diagnosis, and treatment, but it is the second leading cause of cancer-related death in women, and it is extremely expensive to treat. And relapse and the spread of breast cancer, those rates remain high in spite of surgery and chemotherapy. And the chemotherapy, the drugs that they use to treat cancer, have side effects that are risky. It can be toxicity to the heart. There can be suppression or depression of the immune and nervous systems. And so what we look for is a way to improve treatment without increasing toxicity or side effects, as far as looking for successful outcomes. That's a place where fish oils come in as an important approach. So I want to talk about some of the benefits of fish oils, both for reducing risk of cancer, but also improving treatment and prognosis. So we know that supplementary omega-3s are recommended for heart disease. That's kind of a first course of recommendation when someone shows up with heart risks. Their family doctor, or if they've been referred to a cardiologist, their cardiologist will probably recommend boosting the marine omega-3s with certain specific doses. But one of the reasons why we recommend fish oils for people that are interested in breast health is in Western societies that have low intake of omega-3 and yet very high intake of omega-6. These come from animal fats like pork and beef, and in some cases dairy. And they also come from the plant oils that a lot of people cook with. Now, a great choice to avoid a high omega-6 cooking oil is olive oil, which is more of an omega-9. But the corn oil, safflower oil, those types of oils are pretty high in omega-6. And corn and soy as grains is very high in omega-6. And so when we eat animals that mostly eat corn and soy, so that's animals raised in finished in feedlots, that really boosts omega-6 in those animals, which then, of course, transfers to us when we eat those animals. And when we eat a lot of corn or a lot of soy or foods that contain a lot of ingredients derived from corn and soy, that boosts omega-6 levels too. So when we have a low omega-3 to omega-6 intake ratio, there's an increased risk of breast cancer and also heart disease. Another reason to take fish oils is that we see a really low incidence rate of breast cancer and heart disease in populations who enjoy a high intake of fish and marine omega-3 fatty acids. So Japan is a good example of that. In the United States, Alaska, they have higher intakes of omega-3, and also in Greenland, you see very high intakes of omega-3. And those higher marine omega-3 intakes are associated with a lower incidence of breast cancer and also heart disease. We see a dramatic increase in the incidence of breast cancer and heart disease in people who come from low incidence areas, but they migrate to Western countries and they adopt. So we see lower rates of breast cancer in people who eat the traditional diet in Japan, but if they move to America, their risk to the risk they adopt our much fish, their omega-3 intake relative to omega-6 declines precipitously, and then they're right up here with us for risk of breast cancer and heart disease. So that's another reason why we recommend taking fish oils to boost that omega-3 intake relative to omega-6. Oil and high dietary consumption of fatty fish has associated with a reduced incidence of breast cancer. And there is very convincing lab work that has been done where they've incubated subtypes of human breast cancer cells with DHA, one of the marine omega-3s, or combination of DHA and EPA, which is what you usually get when you take a fish oil supplement. When they do that, when they incubate those breast cancer cells, it kills them. It decreases the survival of tumor cells. Now, I want to make a point that it doesn't hurt healthy cells, but for some reason, these marine omega-3s actually cells. Now, this is in that this observation is discussing. So, but balance is the issue. I alluded to the balance of omega-3 and omega-6, and in human studies, women that have evidence of high intake ratios of the omega-3s, EPA, and DHA relative to omega-6 of breast cancer compared to women EPA, DHA relative to arachidonic acid. So what is arachidonic acid? Because I hadn't mentioned that before. When we eat a lot of omega-6, our bodies convert the omega-6 from the foods, which is linoleic acid, into a metabolite called arachidonic acid. And the reason that we know about and care about arachidonic acid is because it is a driver of inflammation. So it's a very pro-inflammatory omega-6 derived fatty acid. It's not just inflammation either. Arachidonic acid is associated with pain. So that breast pain issue can be driven by high omega functions. Arachidonic with poorer blood vessels, and it's more of a heart disease conversation the functions of arachidonic to make sure at the influence of arachidonic acid, and very progressive cardiologists and also integrative practitioners, physicians. I mentioned Chris Northrup earlier. She measures that ratio. The ratio is discussed a lot at the integrative conferences that I go to, where doctors who practice functional medicine and integrative medicine go to get their continuing education. I am lucky enough to get to attend a number of those in the course of a given calendar year. And I hear this discussed quite often, this balance of omega-3 to omega-6, and also this appreciation of this ratio of EPA to arachidonic acid. So what we find is when women have a better balance there of the EPA or combination EPA-DHA relative to arachidonic acid, they have a reduced risk of breast cancer compared to women who don't have a better balance there. And dose matters when we talk about this. So, clearly you get that I'm advocating here that that we all avail ourselves of EPA and DHA from supplemental omega-3, so fish oil supplements, and especially if you don't eat fish. Or if the fish that you eat is a low omega-3, so an example of that would be something like tilapia. Or if the fish that you eat is fried, an example of that would be the fried fish sandwiches that we often see in restaurants, or fish sticks that we see in the grocery store. An example of that is most of the fish that's served in pubs in the UK. The United Kingdom is one of the only places where people have a fairly decent fish intake, but they don't enjoy the protection of that because they fry it. Frying it sort of derails the beneficial fatty acids. But the dose matters when you're taking omega-3, because you're not going to overcome the relief of this chronic inflammatory condition of higher arachidonic acid if you just take a low dose fish oil supplement. So here's an example of where I think sometimes people rightly can be a little bit confused. The American Heart Association has a healthy person recommendation for fish oil of 500 milligrams of EPA plus DHA on a daily basis. That's what they recommend. That's an intake recommendation for healthy people. Well, that's not enough to put you in a place where you're going to have a good ratio of EPA-DHA to arachidonic acid, or even a target blood level of EPA-DHA. So if the ratio of the EPA and DHA to arachidonic acid in either blood level or tissue level is a concern, the intake needs to be 2,000 to 3,000 milligrams daily of combined EPA-DHA, or approximately 2% of calories. Dietitians think in those terms, 2% intake in terms of like total caloric intake. The rest of us do not think that way. People don't go to the grocery store thinking, let's see, I need 2% of this food group, and I want 45% of this other. We don't think of it that way, so it's more functional. It's a better actionable recommendation to say 2,000 to 3,000 milligrams a day of combined EPA and DHA, meaning when you look at your fish oil supplement, read the supplement fact panel and see what the serving provides, and take however much you need to take to get up to between 2,000 and 3,000 milligrams of EPA-DHA. That's what's going to result in a tissue level ratio of EPA and DHA to arachidonic acid that approaches the kind of balance that we're looking for in order to reduce risk of chronic issues. So now, animal studies have shown that omega-3s are very helpful when we talk about breast cancer. When we have mice that have mammary tumors, when they treat them with a combination of either EPA and DHA or DHA alone, when they give this to them just like we would take a supplement ourselves, the tumor growth on those mammary tumors is decreased. And the anti-cancer effect is specific to the cancer cells. Healthy breast cells are not negatively impacted by DHA and EPA. So again, the DHA and the EPA are having an effect that is selective to the cancer and not to the healthy cells around it. Now, there was a very good study looking at 35,000 post-menopausal women. These were women that were between the ages of 50 and 76. They followed them for 6 years. This was in Cancer Epidemiology, Biomarkers, and Prevention. That's the name of the journal. And after 6 years of follow-up, they discovered a 32% reduced risk in developing ductal in situ breast cancer, which is a common form of breast cancer. 32% reduced risk in the women who supplemented with omega-3 fish oils compared to women who didn't take fish oil supplements. That's a pretty good finding. So that's one study that I and reference are, you can make them available that you can have about a particular study, open access, and authorized to share it with everyone. Treatment. So here's a benefit where ones who have, that's an issue, this weight loss, wasting kind of situation that happens is something that people struggle with. Anemia is another thing. So decreasing side effects of treatment is a benefit here, and increasing sensitization to hormonal and cell-targeted therapy is another benefit. So fish oils, when used with the blessing of the oncologist in conjunction with cancer treatment, have made the treatment more effective. So the cancer cells are more sensitive to the chemotherapy. This has been seen in studies, and that's pretty exciting. So improving the efficacy of the treatment while reducing side effects. And one of the benefits, one of the reasons that we see this improved quality of life in women who are undergoing cancer treatment is that one of the benefits of EPA and DHA is insulin sensitizing. So we have better response to insulin. We're not insulin resistant. We're more functional in terms of our carbohydrate metabolism. And so that's one of the reasons, this making the cells more sensitive to insulin, and also there are anabolic, so that's building, and that relates to muscle and tissue. Anabolic effects suggest that this is why omega-3s might be reducing chemotherapy, loss of muscle mass, and also weight loss. So that's just another benefit of omega-3s. And I do want to stress the point that if you're undergoing treatment, you must have the blessing of your oncologist. Some oncologists are open-minded about using omega-3s. Most of the oncologists that I cross paths with are. and have read the studies and have seen some of the benefits. So there are some explanations, and I've alluded to a number of them that explain how DHA and EPA can improve breast cancer treatment. One is by inhibiting the spread of the cancer. We call it metastasis. So cancer can start in one place and then it might move to other areas in the body and other organs, and the EPA and DHA have some benefit in inhibiting that, decreasing the growth of the tumors by being tumor specific. So that's something that I spoke about, is that, the EPA and the DHA seem to have the influence on the tumors themselves and not the healthy tissue around them. So that's a benefit. Inducing cell death in cancer cells, we call it apoptosis, is something that happens with omega-3s. Improving anti-cancer immunity. So powering up our internal defenses against the cancer cells, and then also reducing the numbers of tumor-initiating cells. So these are all mechanisms that explain how DHA and EPA can improve breast cancer treatment. I want to change gears just for a second, even though we said this was omega-3s and breast health. I want to point out a benefit of vitamin D. This slide is a slide that I got from the author Cedric Garland of some of this research. Dr. Cedric Garland is at the Moore Cancer Treatment Center in the University of California, San Diego, and he's a well-known vitamin D researcher. And I was at a vitamin D conference in Toronto in 2005 when I heard Dr. Garland present this slide, and I got goosebumps, because what this slide is discussing is a significant reduction in incidence rate of breast cancer correlating with nanogram per milliliter levels of vitamin D. The lower the level, the higher the risk. The higher the level of vitamin D, serum vitamin D levels, the lower the risk. And what this chart maps out is that compared to women who have a very, very low level, a deficiency level of vitamin D down around 0 to 10 nanograms per milliliter of vitamin D, when women get to 48 nanograms per milliliter, they have half the risk. They only see half of the numbers of breast cancer cases among women that are achieving a much better target serum level of 25-OHD, which is circulating vitamin D. Now, the thing that this graph shows when you plot the graph and follow the line is that that benefit continued to increase. And they said, and this was where the goosebumps came in, Dr. Garland said in that lecture, we have not seen breast cancer in a woman whose level was 70 or higher. Now, let me preface by saying that normal for vitamin D for 25-OHD ranges from 30 to 100. So 70 is not outrageous as far as a vitamin D level. But let me also say that it is just a well-known situation that people in Western cultures have very low vitamin D levels unless they've been paying attention for the last decade or so to all of the conversation around vitamin D. And so that day, goosebumps, on board, I decided personally 70 is going to be my number for serum vitamin D. That's going to be my target. And even though normal starts at 30, 30 isn't going to be good enough in my opinion, because look, you have 50% lower risk with 48, and that bar, that risk just declines. And so I just upped my vitamin D dose and played with it. There's been a lot of time between 2005 and now, to the point where I take around 8,000 units a day of vitamin D. I'm in my 60s. Older people sometimes need a little more vitamin D. That's the amount that I personally need to maintain. That's the intake that I need to maintain in order to keep myself up at around 70. Everyone is different. So I want to point out that individuality plays a role, and you may be able to be in the mid-range for vitamin D with less than what I have to take. But in general, most people are recommending that if you've never been measured for vitamin D, do so that you don't unknowingly increase your risk of the different vitamin D associated issues by having a very low level of vitamin D. And if you haven't had a measure, it's perfectly safe to take up to 10,000 units a day. And most of the time we say, go get tested. But in the meantime, you probably want to be taking at least about 4,000 or 5,000 units of vitamin D on a daily basis, until you have a chance to get in and get the blood work done. And vitamin D doesn't increase quickly. So if you've never taken vitamin D and you have a very low level, it's going to take you about 12 weeks to get that vitamin D level coaxed up to a better dose that you're probably. So threes are very important for us, but vitamin more optimal OHD. That's what you also very best health. That I was talking about. LuckyVitamin is a great place to get good Carlson supplements that can help you maintain target levels of the omega-3 fatty acids and also your vitamin D. So I just want to point that out, that there are a number of very high quality supplements made by my employer, Carlson Laboratories, and our sponsor today, and our real sponsor today, LuckyVitamin, who can make them available for you. So with that, I am now all yours for questions.
Thank you, Julie. That was full of great information. We do have a few questions we want to get right into. The first one is, and you may have already answered some of these questions, but if maybe you could touch up on them again.
Sure.
Women that are breastfeeding, should they take more omegas?
Well, yes, and particularly because the breastfeeding period is a time of both restoring mom back to pre-pregnancy DHA status. Here, when we talk omega-3s, we really are talking mainly about DHA. EPA has some benefit, but really it is the DHA and the result of DHA through pregnancy and during the breastfeeding period on the development of the baby's nervous system and vision. So the our brains are mostly fat, and a large percentage of that in ideal circumstances is going to be DHA, which has to do with cognition, it has to do with mood, it has to do with behavior. And mom donates DHA during pregnancy, and especially if her diet doesn't have a lot of DHA, but mom donates the DHA, builds that baby's brain in the womb, and develops hopefully very sharp visual acuity in the womb, and then during the breastfeeding period is still passing along these really important building blocks for health for children. So that 2,000 to 3,000 milligram combined EPA DHA, and in this case I would say with emphasis on DHA, recommendation that I made will support mom to a target level that she needs for her health, help her replenish what she donated during pregnancy, but also will give her a reserve to pass along in the breast milk for the baby.
Makes sense. If someone has a history or has been diagnosed with breast cancer, should they take more omegas than what's suggested on the bottle?
Yes, the bottles usually suggest, the bottles don't always make a suggestion, or a lot of times manufacturers will suggest a dose of 1 or 2 capsules, and depending upon the formula, that may be achieving somewhere around 1,000 milligrams combined EPA-DHA. If it's a liquid, then it probably will be a little bit higher, but I'm recommending 2,000 to 3,000. And so you're probably, unless you're taking a very high potency omega-3 supplement, you're probably going to need to take more than 1 serving. So you may need to double up on the serving. And so that's why it's important to read that label, the backside, the supplement fact panel, and see how much EPA and DHA the serving provides, and then multiply it up to get you to that point of 2,000 to 3,000 combined EPA-DHA.
Okay, and kind of to follow up with that question, how would you know if you took too much omega-3s?
Well, we don't ever meet anyone who has. So how would you know? The only way that you would really know that you had gone too far would be if you did omega-3 blood test. It's called Omega-3 index, and you were way off the chart. But in the development of that blood test, the people who have developed that blood test, the doctors who actually were the conceptual parents of the omega-3 index, they have given us a lot of data about all the people who have done the test to date. And 80% of the people, and most people have never even heard of an omega-3 index blood test. So you've got to imagine that for people who have actually asked for that test, they're a somewhat interested population. So they're probably not the non-consumers of omega-3s, but even among this interested population of 10,000 or 15, it's probably up to about 20,000 people now, 80% of them were not reaching target levels. Only a very, very few were exceeding target levels. So the way you would know would be to do that omega-3 index test. It's important, though, to realize that what we're talking about, when we talk about 2,000 or 3,000 milligrams, we're really talking about, again, around 2% of total calorie intake for that amount. So you're not going to sit down, with a omega-3 marine fish oil cocktail at dinner time. We're not talking about, vast quantities or glugging down half the bottle. We're really talking about, in most cases, if you're taking a liquid, somewhere around a teaspoon to maybe as high as a tablespoon of fish oil. So there wouldn't be a reason to exceed that. But the only way you would really know that you're just kind of overdoing it, which, by the way, would be expensive, the only way you would really know would be to get a blood test.
Yeah, I'd be pretty surprised if someone sat down with a fish cocktail, that's for sure.
Okay, yuck. Now, for people that are old enough to remember, like, the very first couple seasons of Saturday Night Live, they had this thing called a Bass-O-Matic where Dan Aykroyd put a fish, dead now, but in a blender and just kind of hit the key and then drank it, which, that's not what we're talking about here. We're talking about a little teaspoonful of fish oil or a few capsules of fish oil. We're not discussing the Bass-O-Matic, and nobody sits down with a, omega-3 martini. It's just not happening.
Right. Would you recommend someone under 18 to take fish oil, and what are the pros and cons?
Yes. The cons are Scholastic achievement is not optimal if the brain is not optimized for omega-3 during adolescence or even during pre-K, kindergarten, grade school age. Many studies have been done looking at behavior issues, violence, anger, dramatic outbursts are reduced when children and adolescents have better intake of omega-3. And let's face it, kids are not known for eating a lot of fish. So fish oil supplements are the way that parents can boost the omega-3 intake, which is associated with better achievement in school, better behavior in school, in infants sleeping through the night sooner, which is a gift to everyone involved. When a baby's mother has been adequately nourished with omega-3 and she's passing it along in breastfeeding or as a supplement, if mom isn't breastfeeding, the infant needs supplemental DHA. When that happens, the baby is faster to develop skills of self-soothing and will sleep through the night. And in studies where they had age 6 to 12, people with developmental coordination disorder, reading and language challenges, and they put them on DHA supplement, and in this case it was 600 milligrams of DHA. The parents reported, as an aside, that those children were sleeping through the night where they had been waking up several times a night. They were poor sleepers, they became good sleepers. So there's so many benefits. I can't think of a con, I can only think of pros.
Yeah, that's definitely a pro. We do have one last question. Help the body absorb breathe better.
And tissue levels achieved. So probably the evening meal, unless you're one of those people that does your big meal at lunchtime. And it isn't necessary to divide doses of omega-3s. You can take them all at one meal. And if you forgot yesterday's, double up today. It's okay to do that too. You can make it up. But yes, a meal with some fats is really the way to absorb them most effectively. And then if you know that you have digestive issues where you have trouble with fats, I would get a good digestive enzyme that has some pancreatic lipase, and that will also help with the absorption.
Good to know. We're going to wrap things up now. Thank you all again for attending, and thank you so much, Jolie, for all of that wonderful information. If you have not done so already, please register for our upcoming webinars. For more information, please visit LuckyVitamin.com and search keyword webinar. Thank you.